Karen, thank you very much. And we'll turn very quickly to Daniel Rodríguez. Majority of Daniel's work is driven by practical problems and finding solutions for planners and policymakers. With that.
Thank you very much, Governor. And I want to thank also the workshop organizers for inviting us here. Thank you to Rodrigo and Karen for a great presentation and a great setup. I think I'm here as a representative of an academic discipline that is largely responsible for this mess, city planning and transportation planning. So hold the tomatoes for the end, please. One reason that I'm going to be talking about transportation land use, and I think both Jim and Rodrigo talked about this, is that the built environment impact on health is mediated through things like our transportation and our activity and our land uses. And so focusing on these mediators is going to be important to understand what evidence is out there for the interventions to come. Most studies have focused on physical activity, partly because the connection between activity and obesity is fairly well established. But I want to take a step back here and really kind of honor our workshop title and focus on obesity outcomes and weight outcomes, so that we focus on this new and emerging evidence of the last 5 to 10 years to highlight some of the important relationships. I'm lucky that my field is not as complicated and nuanced as Karen's. And I always just marveled at the nutrition studies because the sheer complexity is astounding. And so we do have an immense task ahead in trying to merge these two worlds, the food environment and the physical environment, and see how together they interact. So in thinking about weight outcomes, I also want to highlight that we've measured weight in very different ways. It could be BMI, it could be waist circumference, it could be percent body fat, et cetera, et cetera. Some of these outcomes and different ways of measuring them are going to come up as I go through my presentation in the next few minutes. So I'm going to, as Karen did, talk about the ingredients first, the transportation pieces, if you will. And then I'm going to talk about the destinations, because we don't move just for the sake of it. We move mostly because we want to get to places. So it's the land use, it's the destinations that matter. And then think about this multi-component piece, right? It's the package. It's all together that seems to be mattering more. And so that's where I end my presentation. Let me start with connectivity. Jim had some great introduction here. In the upper right-hand side, you see 1 square mile definition of 2 places close to where I am now, San Francisco in the top and Sacramento in the bottom. So the scale is the same, and yet you can see as a pedestrian, for example, that traversing space in San Francisco is going to be much easier, not only because of the connectivity that this network provides, but also because it provides many options for crossing, perhaps stopping traffic and allowing the pedestrian to move across. That might be a little much harder in Sacramento here. And so connectivity matters for distance, connectivity matters for dealing with traffic. And highlighting a very recent study, the Recite Project, one of the better studies that have emerged over the past few years. This is from Perth, Australia, following more than 1,800 participants that move into 73 new neighborhoods. And in that study they found that street connectivity was undoubtedly associated with higher walking. And there was a follow-up to that. One of these modeling exercises that Rodrigo discussed, 2016, that as soon as I read it, gave me a little pause. But then as I reflected on it, it made a lot of sense. So in low-density cities, like many cities in the US, many cities in Australia, it turns out that their modeling, based on the evidence, suggested that installing sidewalks in these existing neighborhoods, kind of retrofitting sidewalks, as a single intervention is unlikely to improve health in a cost-effective way. Now, as you think about this, it makes a lot of sense. Having what I call the peekaboo sidewalks that we see in suburban US. Right now you see them, now you don't. They have dead ends. That doesn't help us very much. We want the sidewalks, number one, that give us connectivity, and number two, that lead to places, that connect us with places. And so increasing the density allows us, number one, to increase the cost effectiveness, and increasing the mixture of uses allows us to use these facilities more, hence becoming more cost effective. So this is pointing to the idea of the whole, the package, being more important than the ingredients only. So this finding is really only about the sidewalks themselves. Traffic. So traffic is one of those second-order impacts of automobility. And in this study by Mike Jarrett and colleagues, they looked at children initially at the age of 10 in the mid to early 90s, and then they followed them all the way till they were 18. And they looked at how the BMI changed over time relative to traffic around their homes. So you see here in the y-axis is the BMI difference between two groups of children. The first group is the group that had the 90th percentile of traffic around their home. That is fairly high traffic. Just to give you a sense of how that high traffic meant, it meant being in an arterial street. So a street that has significant traffic, I'm not going to use the lingo of transportation planners, AADT, compared to children in the 10th percentile, so low traffic. This is closer to living in a street that has maybe 5 or 6 households. Could be a cul-de-sac, could be a connected street, but low traffic. And you see the BMI difference of about 0.27, which is fairly limited, fairly small impact. If you project that to 18 years of age, it's about a 5% difference. But if you also project it across the entire population, we're talking about huge impacts or small impacts across a huge number of people potentially. And this was true for males and females, and it was true for areas closer to home than further away from home. So clearly in this case, I think the traffic was really acting maybe as a surrogate for pollution, maybe potentially also as a big barrier, just getting out of the home as an important barrier to get to places. Cycling infrastructure. So this is a great categorization that transportation planners are now using thanks to a bicycling planner in Portland, Roger Geller. This is categorizing cyclists in the world, or categorizing us in the cycling world. Some of us are strong and fearless. We would bike no matter where we were, right? Some of us are the green bars here, kind of enthused and quite confident. But the vast majority of us are in this yellow bar, right? Interested but concerned. I'd like to bike, but I'd like my child to bike, but safety is a concern. And there's about 30% of the population that is no way, no how, I won't do it, I don't want to do it, no interest. It's this yellow bar that really pushes us to think and have pushed transportation planners to think about bicycling infrastructure. Because it's those individuals that are the ones that are going to start being physically active if we make bicycling safer for them. A great study here, the Commuting and Health in Cambridge study, just published recently, followed 809 adults over time, over 3 years, and found that those that maintained bicycling commuting over a year had 1.1 points lower BMI at the end of the year, adjusting for a variety of different individual level characteristics and adjusting for other physical activity. So they're not replacing. They used to run, now they bike. No. It's controlling for that. They have a much lower BMI than those that stop bicycling or those that don't bicycle. Salt Lake City added a bicycle lane as part of their rail investment. And so in the MAP study by Barbara Brown and colleagues, they tracked people with GPS units and with accelerometers over time, 536 adults, and they found relative to bicycle lanes that individuals in their study that used the bicycle lane for longer, more time, had lower BMI and burned more calories than individuals that didn't. And I'm going to go back to this study in a second because they also tracked rail users. That's an interesting outcome. Mass transit. This is a great study. This is kind of a follow-up to an earlier one. This is mind-blowing to me because this is based on the National Household Transportation Survey of the U.S. 2009. The new one is about to be released. But based on these data, Freeland and colleagues found that the median commuter, transit user in the U.S. walked 21 minutes a day to and from public transportation. Think about this. 50% of all transit commuters got 100 minutes a day, a week, of physical activity, walking, solely from getting to and from transit. If this is not a public health intervention, I don't know what it is. It's absolutely amazing. Other evidence points to this as well, which is about 100 calories per day, roughly speaking. Two rail studies come up to mind as really important. The first one is the Charlotte Link study, Charlotte, North Carolina, comparing before and after individuals that were part of the intervention using the rail system versus individuals that didn't. And what did they find? They found 1.18 lower BMI over time, so decreasing BMI and decreased odds of obesity compared to individuals with similar characteristics at baseline. And going back again to the Salt Lake City study, they broke their data a little differently, but those individuals that started to use the Salt Lake City system, forget the acronym, decreased their BMI by 0.29 points. This is this right-hand side black bar. Decreased their BMI relative to non-transit users that are on the left-hand side. Now look at the tallest bar here. Those are individuals that before the rail investment were using the bus, and now because of reconfigurations and changes, they're not using transit anymore. They actually increased their BMI over time and became more sedentary, engaged in less physical activity. So all the evidence in this case is fairly convincing, pointing to the same direction. I'd be remiss not to talk about cars. I talked about traffic in terms of maybe barriers, but just being in automobiles is unhealthy for us. It makes us sedentary. We're sitting in them. You see here, this is an ecological study from California. On the x-axis, you see quartiles, in this case, of time spent in vehicles. On the y-axis, you see the prevalence of obesity. Simply said, the more time we spend in a vehicle, the higher our obesity. This is again at the county level. If you add or look at miles traveled instead of obesity, we see the same relationship. Transportation planners are gung-ho about automated vehicles. This is not going to go away, right? We're not going to be exercising automated vehicles no matter what. So this is here to stay no matter what happens to how we drive around town. This is important. The second piece is land use. The mixing of land uses is very important. A recent review found that land use mix and urban sprawl were the more consistently associated factors with overweight and obesity than almost any other environmental factor. We talked about the Community Preventative Services Task Force ratifying its recommendations about mixing land uses and increasing density that are very important. And I highlighted before the relevance of density also as a synergistic factor in improving the impact of certain interventions. Let me quickly go through the package because I think this is where the punchline ends up being. So the package is when we are thinking about things like walkability. So it's all of these things together mixed. You have the density, you have the destinations, you have the diversity, all the Ds that Rodrigo identified in his complex model. And starting with cross-sectional evidence from IPEN, 17 cities, 12 countries, more than 14,000 respondents, and the walkability index was one of the most strongly associated environmental factor, negatively associated with the odds of being overweight and obese and to BMI in this in pooled studies and then in the individual countries as well. Karen talked about the NIC study. This is a slightly different way of showing it. If you recall, in the study, they looked at the physical activity environment, x-axis, high-low, and the nutrition environment, y-axis, high-low. So really our eyes should be focused on the diagonal, right? The high-high versus the low-low. That's a maximum contrast. And they looked at overweight and obesity. Across this, I'm looking at children, and they're controlling for parent weight status and then a variety of different social demographic characteristics. And what they found was, as you see here, a dramatic difference in obesity, as a difference that's still marginally significant for overweight as you compare individuals falling in these two quadrants. The MESA study, 6 cities, more than 5,000 participants enrolled at baseline in the year 2000 without any clinical cardiovascular disease. The cities vary, all in the U.S. Forsyth County is where Winston-Salem, North Carolina is located. We assess BMI and waist circumference at baseline and then 4 and 4 periods subsequently. And we merged all these walkability measures like density, land use, destinations, et cetera, these ones, these ones here into 3 factors that I'm highlighting here. And basically the punchline here is that development intensity, which was part of presence of walking destinations, density, and retail development, was associated with less pronounced increase in BMI and a decrease in waist circumference. As we look at people that moved, this is now not using that index, but using the walk score that many of us now are familiar with. So this is looking only at movers. Some people move from non-walkable to really walkable. Some people move from really walkable to non-walkable. So we're looking at their changes over time. We find that transport walking increases for every 10 minutes more of walkability that you get into as a mover. And then the odds ratio of meeting recommendations from everybody walks increase, and mean BMI, small change, but it's significant, decreases. And just to end, recently published Journal of the American Medical Association study, Southern Ontario, looking at overweight and obesity from a community survey, and created this walkability index in quintiles. The graph is a little complicated, but I want to walk you through it, and I want to highlight 3 things. This is what they reported in the paper. The first point is the highest quintile for walkability is this orange curve here, the bottom one. So as you can see, the prevalence of obesity is lower for the quintile of highest walkability. They have the lowest overweight or obesity in the y-axis. Secondly, for the bottom 3 quintiles, the places that are least walkable, you see an increase over time, and that increase, I can tell you, is between 5.4 and 9.2% over time. These are cross-sections of the survey over time, and you see overweight and obesity increasing for the least walkable places. And for the most walkable places, the orange curve and then the other light blue squares, it's flat. It's not increasing over time. So those are kind of the 3 main lessons that I draw from this. Summarize really well the impacts of walkability on overweight and BMI. So to conclude, the magnitude of the challenge here and of the potential actions, I would rough estimate, that half of the US population lives in suburban environments right now. So this is the magnitude of the task ahead of us. This is just saying that we're using a threshold of 4 households per acre. So it's really conservative. Almost every city in the US has potential for improving their built environment. Just on the right-hand side here, I'm showing the share of households that live in low-density environments, environments of less than 1 household per acre. Look at that, 5% in LA, 17% in Denver, New York, New Jersey metro area, 13%. This is the potential for retrofitting the suburban areas. Planners, of course, are at the heart of the issue, from multiple disciplines, both as contributors, but also as the potential remedy. And the point here is to stitch a fabric of change that involves all these multiple sectors and all this emerging evidence so that we can do something about this challenge ahead. Thank you very much.
Daniel, thank you very much. At this time, we were supposed to have a vigorous, enthusiastic panel discussion, but the enthusiasm for our individual panelists, myself included, every one of us ran over time. And so we are just flat out of time for this section. However, what we'll do is we'll take our break, which Jim is going to direct us on in just a second, but urge you to think of the questions and discussion, including our panelists, and we perhaps have them over lunch, as well as the questions that will be submitted hereafter. How about a collective thank you for everyone?
Thank you, Governor.
Thank you.
Excellent. Thank you so much.